When I see a patient for Botox evaluation, the way it works in my hands is I see the patient one-on-one, face-to-face consultation. I usually like to have a mirror so we can look at their entire face, top to bottom. And then I like to ask them, to animate their face and tell me what little fine lines, areas, or wrinkles typically bother them. And then I offer them my best suggestion of how to treat those areas. After we agree on what areas to target, typically I'll clean your face with alcohol, just to let that dry, make sure we're all clean. I use a very small syringe and a very small needle loaded up with a certain number of Botox units for each specific muscle. And then we go through the injections one by one. If there's at any point, the patient feels uncomfortable, I stop, we talk through the process again. But typically they tolerate the procedure very, very well. So one of the most common questions that I'll get from patients prior to Botox injections is, does it hurt? As long as you have a trained professional who's done these injections before, it really does not hurt. I use a very tiny needle with a very small syringe, and I do these injections, very carefully and meticulously, so it does not hurt. One of the other most common questions I'll get is, when can I exercise? When can I shower? Can I use my makeup if I want? And typically for all of those, I say give it about 24 hours. After 24 hours, you should be able to wear makeup like you normally do, as long as there's no really aggressive chemicals in your makeup. You can shower with kind of lukewarm water as you normally do. You can exercise 24 hours later and do, anything that you normally is part of your routine without any restrictions.